Hey, everybody, welcome back to the Energy MD podcast. So happy that you're here today, because today we're going to be talking about psychiatry, holistic psychiatry, as well as some of the controversies that exist in the community and some important things to be thinking about when it comes to mental health illness. So really excited to speak today with my guest, who is Aruna Tummala. So she is a board-certified adult geriatric psychiatrist and holistic doctor. She studied functional medicine and Ayurveda and is the founder of Trinergy Health in New Berlin, Wisconsin. She is a hyperbaric oxygen therapy certified doctor and treats and reverses the root causes of mental illness with diet, supplements, Ayurveda, body and detox therapies, hyperbaric oxygen, psychotherapy, and careful use of psychiatric medicines. By reducing the reliance on psychiatric medicines, she reduces the severity and occurrence of side effects while empowering her patients. Dr. Tummala has presented on the topics of mental illness, Ayurveda, and integrative approaches to the mental illness to academic audiences both in the United States and abroad. Dr. Tummala, thank you so much for joining me today.
Thank you, Evan, and please call me Aruna.
Aruna, very good. So let's talk a little bit about this branch or this different paradigm associated with psychiatry. It sounds like you call it holistic psychiatry or integrative or functional psychiatry. What is your preferred term and what is it?
That's a very, very interesting question. At first, I used to call myself as an integrative psychiatrist because I was actually under the impression that the term holistic was somewhat stigmatized and demonized. But in actually looking at what I do, it is really about viewing the person as a whole entity, mind, body, and spirit system together. And so I've actually warmed up to the idea of calling myself a holistic psychiatrist now. So I do think that is the term that I think is most applicable. It's holism, and in terms of the approach that a practitioner brings to the patient. It is also holism in the sense that we're looking at multiple different causes for pathology to exist. So it's a 360-degree view.
So it sounds like that differs from conventional psychiatry in the sense that, medications are only a small part of your practice, and for a conventional psychiatrist, they are most of their practice. Is that correct?
That is correct. Unfortunately, I do think mainstream psychiatry, like with rest of mainstream medicine, has lost its way. It's really become very much focused on pharmaceutical interventions. But we all know, as we learn medicine and then psychiatry and psychopharmacology, we know that these medications, at best, they act as band-aids. There is, the very hypothesis, the foundational hypothesis of chemical imbalance, more and more recent studies are showing that there is no merit to that. There is no chemical imbalance. But increasingly, we are seeing the rates of anxiety, depression are skyrocketing in every age cohort that we are looking at. So if there is no chemical imbalance, but people are becoming sicker and sicker, including our children and adolescents, what is the underlying cause? And that is the important question that we need to look at. But unfortunately, my mainstream colleagues are not willing to do that.
Mm-hmm. So let's go there. So what are the causes that you're looking at that you see in mental health illness?
So, and I did put this down in my book, but to put it very, very simplistically, I think of all diseases, including mental illness, as having three primary root causes and a final common pathway that leads to the manifestation of symptoms of disease. And these three primary root causes are diet, trauma, and toxins. So, and of course, it's not that I don't look at the genetics. That's a big part of what I do, especially MTHFR gene, methylation gene polymorphisms, but also other newer polymorphisms that researchers are finding that have a connection to mental health and wellness. But excluding the genetic component, what I see consistently is that it is a standard American diet, which is woefully lacking in nutrients and filled with artificial franken foods and ingredients that that belong to a lab, not to our bodies. Then the trauma, and under trauma, it's not only, things like head injuries that noticeably cause a clear onset of damage to the brain and the mind, but also psychological trauma. And this can be even subtle forms of trauma, where if the child is being raised by parents who are stressed out for whatever reason and not able to pay attention to the child, and especially be able to provide the pathway for developing an authentic sense of self, that itself is traumatic. And this is not about blaming parents. I have 2 kids myself, and part of my motherhood is spent feeling guilty about the things that I did not do or should have done. It's not about that. It is about recognizing where we are, where the pathways for these illnesses are developing. And a big contribution for me to include trauma as one of the root causes is actually the ACE study, which was done in the 70s, the Adverse Childhood Event Study by Vincent Felitti and his group of researchers. And what they have found, that even psychological trauma, so you don't need to touch the child in any manner, just consistent psychological trauma, one of stress, scarcity, unpredictability, these kinds of things can actually impact this child's health outcomes, physical and mental illness outcomes, even contributing to early death. So that is why I realized that trauma really plays a big role. And the third big factor for us I used to think that this was only in the Western world, but recently I was in India and I was bombarded with so many artificial fragrances wherever I went. And it's not only on billboards, 5 times the fragrance in this particular laundry detergent, it's all being brandished everywhere. Why? Because in the Western world, we are becoming aware of the toxic effects of phthalates and all of these artificial synthetic fragrances. So now these companies are taking their poison to other developing countries in the world and underdeveloped countries. So it was very sad for me to see. But toxicity is a big factor. And the way these 3 things, whether it is the bad diet or the trauma and toxicity, one of the first damages that they cause is to our gut lining. We have seen how inflammatory diets directly disrupt our gut lining, resulting in leaky gut. Psychological trauma, creating a hypercortisol state, also does the same thing. And toxins, whether it is toxins that we are inhaling or whether we are ingesting, whether it's pesticides, too much salt and too much sugar that we find in processed and junk food, as well as the artificial chemicals that are added to preserve food. I think sodium bisulfite is one of them. It's a preservative, or benzoate, I think. I forget the names of these things, But even these preservatives that are used, they have been shown to consistently disrupt our gut lining. And so the gut lining, when that gets disrupted, now the gut lining is the barrier between the true interior and the exterior. And right beneath the gut lining, we have 90% of our immune system. Why is it placed this way? Because before anything passes through the gut lining into our true interior, our defenders, our immune system, are right there to see whether it's a friend or a foe. But with the disrupted gut lining, everything is passing through, triggering our immune system, and inflammation sets in. And this inflammation, in the beginning, will manifest in the GI system. But when it continues and it is not addressed, it's not just about suppressing the inflammation. We have to remove the causes for this inflammation. But if that doesn't happen, over time, it reaches various organs in the body. And when it reaches the brain, we call it as mental illness or neurological illness. So what I'm talking to you about really is the Ayurvedic pathway to diseases. So it's in Ayurveda, they have described this process in much detail. So I've just this is what they describe, and this is what I happen to see over and over again with all of my patients. And so the final common pathway is inflammation, and inflammation reaching different end organs and causing damage, destruction, and impairment in physiology in that end organ. And so it follows in treatment that if we address these 3 root causes, remove inflammation, then we should see improvement. And that is what we see in our patients here. So
Wonderful. Can you tell us a little bit about Ayurveda for those who do not know what it is?
So Ayurveda is India's medical tradition. It's a medical system. It is a very, very old medical tradition. The oldest texts are, I think, 5,000 years old. So it's very comparable to traditional Chinese medicine. Both these disciplines of medical thinking developed probably parallel at about the same time, and there was a lot of exchange of ideas from one to the other. In both these medical traditions, the basic premise is that all matter is not material, but it is made up of energy. So most of the times we are actually talking about the energy constitution, the imbalances in the energy constitution. And because everything is made up of energy, we then use the food or the herb that can complementarily treat the energetic imbalance that we have in our body. So this is kind of the very basic understanding of how Ayurveda works. But it is, I mean, many people don't know about this. It was a complete medical system. And back in the day, like 2,000-3,000 years ago, in the textbooks, we have identified that they had very clearly 8 disciplines: internal medicine, surgery, ENT, pediatrics, obstetrics and gynecology, rejuvenation and anti-aging medicine, toxicology, and psychiatry. And basically the way the term for psychiatry actually refers to it as energy medicine, like diseases of the energetic system of the body. So in other words, from the way, I mean, when I read these books, the way I understand is that they're talking about the software of our body, which is the mind. You know, if the brain and the gut is the hardware, mind is our software. So that's the term that they use for psychiatry. So these were the 8 disciplines. And in the surgical textbook of Ayurveda, very beautiful descriptions of instruments, which are very comparable to modern surgical instruments, but they were mostly made of copper because it is naturally antibacterial. They used a lot of plant anesthetics and different kinds of techniques to numb the area. The procedures, even including orthopedic procedures, cataract extraction, tumor excision, they're all very comparable to modern surgical texts. So it's really fascinating. And they have talked about the microbiome 2,000 years ago without the aid of a microscope. So they knew, our ancient people knew a lot more about the world, the nature, and the functioning of our bodies than what we are able to grasp and understand even today. So, and Ayurveda brings with it this knowledge about the use of herbs and even metals. Like, in rheumatology, we do use gold and silver salts. So even in Ayurveda, there are some formulations that use some of these metals. Iron, of course, is used for different kinds of iron deficiency anemias and, different things like that. But the herbal pharmacology is very extensive. The way we approach any disease in Ayurveda is not by its name, although there are different, diabetes has a name, and, there are many names that are comparable to modern diseases. But the approach in Ayurveda is always to look at where is the breakdown in physiology. And the attempt is to restore that physiological functioning. And one of the basic foundational tenets is that all disease begins in the gut. And so it's with the hypothesis that I presented, with the gut lining disruption and the inflammation that results as a result of the gut lining disruption. That is one of the pathognomonic foundational causes of all disease, according to Ayurveda. So, and the second one they talk about, actually, in fact, even before they talk about the breakdown in the gut lining, the foundational cause for any disease, Ayurveda asserts, is loss of self-worth. So that, for me, that they're talking about trauma there, because that's what happens when we are traumatized, especially in children. We forget our own value. There is an element of spirituality that brings in, and like in the Ayurvedic text, when they talk about loss of self-worth, they're talking about falling from grace, basically. Like, we have forgotten who we are, our innate nature, the holism, our connection to the universe and to everything in nature. When we forget that, then we act and behave, our behaviors reflect that loss of connection. That is why whether it is we are choosing to use drugs and alcohol, knowing that they're bad for us, or not exercising, or consuming media that we know is making us agitated or depressed. We do all of those things because inherently we don't value ourselves, because we have forgotten how valuable we all are. Simply, the fact that you're a life form itself assigns value and worth to us. But when we forget that, we go down this path of actually creating these diseases for ourselves. So there's a lot of personal responsibility that is also emphasized here.
So how do you remedy that loss of self-worth?
The pathway to that is through meditation. But the actual technique, the way to remedy that is by getting to know oneself. It is through introspection and going inward, which is what happens when we meditate. And becoming, developing that participant observer attitude within oneself. So, and that also can only happen once we dedicate, even if it is 5-10 minutes of our busy days, to going inward, meditating, centering our breath and our physiology, and simply closing our eyes and going inward. And when we do that, we slowly begin to awaken our soul. And then when the soul is awake, then the soul becomes really observant about what we are thinking, how we are behaving. And it's Jiminy Cricket, in other words. We need to waken up our inner Jiminy Cricket. So
very nice. So just 5 minutes a day to get started, and paying attention to the breath in and out.
In and out, yes. Yeah. So actually, in fact, there is an exercise that I teach my patients, and I found this in Eckhart Tolle's book, The Power of Now. So this is a very easy way to, one, recognize that we all have an inner entity that is separate from our mind, which I call the soul, but people can call it whatever they want. But we are not just our body and our mind. There is something else. It is that deepest part of our subconscious, which in times of intense crisis, we will hear it. We will become aware of it. When we are in that state, when our life depends on it, or in whatever way, we do become aware of it. But the practice of meditation and introspection makes it so that we are more in touch with this inner entity within ourselves. So this exercise in this book, Power of Now, is very simple. So you close your eyes and you focus on your breath, and then you ask yourself, I wonder what my next thought will be. And you simply wait for the next thought to come. So as soon as a thought comes into your mind and you see the thought, so right there, you can see that there is an inner you that is able to, quote unquote, see the thought. So our goal in meditation is to go and align more with this inner conscience or soul. So creating that distance between the mind and the soul will slowly help us realize that what the mind is doing. Mind is all about conflict, right? To do or not to do, to be or not to be. That's what the mind creates. And it never is able to give us a clear solution. Solutions only come from our inner conscience. A clear answer comes only from the inner conscience. But the noise that the mind creates for most of us, we are so hyper-focused with our mental activity. We think that that is the way to be. But in fact, that is what causes many of our neurosis. So I've had patients with OCD, once they start doing this, they can actually go into their inner soul alignment and see the obsessions happening in their mind. But now they don't have to engage with it. So it's a very curious experience. It's a very whimsical experience that some of my patients actually describe. But once they get it, you can actually see the OCD melting away. But I will also say, to be able to get to that level, yes, you need to spend those 5 minutes and practice. But if you're inflamed, if you're having leaky gut, if you're nutritionally depleted, it's not going to be that easy. Just like, hangry, when you're hungry, you get angry. So when you're nutritionally sated, then you tend to be more calm. In the same manner, for any form of psychotherapy or inner work to happen, we need to first take care of our physical body. This is the first level that needs to come into balance. Doesn't mean that you still don't spend those 5 minutes, because that is also a way that you are sending a message to your nervous system and to your mind that I am valuable to me. Because as adults, the only way to find self-worth is with these acts of value that we do for ourselves. So
good. Thank you for leading us through that. I highly recommend that people start doing that. And it's so important. I'm so glad you brought that up, that it is a complement to all of this. We have to be mind, body, spirit, emotions in order to be able to have true success. So let's go back to the diet for a second. So what do you recommend generally for a healthy diet from a mental health perspective? Does it have to do with the doshas, or is there one that's better than others? What has been your experience?
So for most people that coming to the practice, at least from my experience, what we have seen, the most common dosha imbalance, dosha is one of the 3 energy types that we identify in Ayurveda, is the pitta dosha, which is to do with inflammation. So there too, we are saying that almost everyone is coming in with inflammation. So one of the first things that we do is put them on a pitta balancing diet, which is the anti-inflammatory diet. So this anti-inflammatory diet, it's again very similar to many functional medicine recommendations. It's no dairy, no gluten, no corn, no soy, and no eggs. So these are the 5 things I do recommend that people eliminate for the first 6 weeks at least. Very religious about that. And but that is just eliminating these foods is only stopping the attack. We still need to pay attention to what can repair the gut lining. And that can differ a little bit to each individual person and their presentation. But some of the common, so what I mean by that is that sometimes I'm giving people probiotics right at the beginning, because that's what seems to be what is needed. Or I'm giving people, a fish oil, or I might recommend a free-form amino acids, or, there are different things. But the common things that seem to be required for everyone is actually bone broth. Collagen powders too, but I like to recommend whole foods. So because, collagen is an aspect, is one of the components of the bone broth. But the bone broth has not only the collagen, which is part of the protein component, but it also has healthy fats in it. And it will also have the fat-soluble vitamins in it. So nature packages it best. If you're able to make your own bone broth, we have a recipe for that on my website. So that's great. Otherwise, nowadays we are able to get many commercially available formulations, which are pretty decent. But the foundation for any diet change is that it has to be organic, it has to be whole. Cook at home. Use clean ingredients, make sure that you're not using non-stick cookware, avoid toxins as much as possible, use healthy fats. And what I mean by healthy fats is extra virgin olive oil, clarified butter or butter, and sesame oil, peanut oil, organic peanut oil as well, if a person does not have allergies to peanuts. So these are the different fat. And lard, if you can cook in lard. Bacon is good, provided it is organic and grass-fed. And whenever we are consuming a high-calorie food, we really need to limit the quantity. And for that, if we are in tune with ourselves, if you're sitting in front of the TV and, eating bacon or ice cream, even ice cream is rich in fat, but you're going to finish a tub without realizing how much you ate. But if you're mindful and present with it and paying attention to your sense of taste and the satiety, then you're going to eat what is good for you, what is right for you. So these are some of the basic, guidelines that we provide in terms of diet. And some people require more fine-tuning according to their doshas, but for most people, this seems to be more than enough. So these are some of the foundational changes.
And you mentioned amino acids. In what situations do you find that people require amino acids?
Amino acids, when I suspect that, as number one, when they're very depressed or very anxious. I've seen that giving them a 1-month course of free-form amino acids seems to help. Because again, depression and anxiety can also be seen as a severe deficiency of these protein building blocks, which are very necessary for making the neurotransmitters. If I suspect digestive problems, in the sense that if clinically and through the interview, if I'm picking up on the fact that they're not making enough digestive enzymes to break down the foods that they're eating, that would be another time that I would consider doing free-form amino acids. Mm-hmm. And sometimes when people are struggling to taper off of their medications, that's another time that I would use free-form amino acids.
So you mentioned amino acids as precursors to neurotransmitters. So that's a great transition to talk about the serotonin hypothesis and the neurotransmitter hypothesis for psychiatric illness. Can you tell us a little bit about what are some of the latest updates that have happened over the last year or so?
Sure. So one of the basic hypotheses in psychiatry in terms of the cause of psychiatric illness was the so-called chemical imbalance theory, which basically means that there are certain neurotransmitters or chemicals in the brain, and each of these chemicals, when they are in a state of imbalance, then they manifest certain diseases. For instance, if it's a serotonin imbalance or norepinephrine imbalance, we may see symptoms of depression or anxiety. If it is a dopamine imbalance, we see psychosis like schizophrenia or bipolar disorder. Or if it is a broader imbalance of other nerve stability imbalances, then we may call it as a mood disorder like bipolar disorder. But and then of course, based on these hypotheses, we had all these different classes of medications like benzodiazepines, antipsychotics, and antidepressants. And the whole promise was that they were going to cure psychiatry for good. But that has not happened. And so when we go back and look at actually all these studies, even looking at animal studies and preclinical studies where they've actually looked at serotonin metabolites, dopamine metabolites in patients experiencing these different illnesses, no consistent hypothesis has come out. What I mean by that is that sometimes, yes, we do find low serotonin in patients that are depressed, but equal number of times we are finding that there is high serotonin in another group of people that are depressed. Same thing with psychosis. We are seeing some patients having very low dopamine levels and other patients having very high dopamine levels. Mm-hmm. And even in terms of treatment, what we see is that in the beginning, whether it's an antidepressant or an antipsychotic, patients seem to respond, meaning that, oh, this antidepressant is increasing serotonin levels and then their depression is going away. But when you continue that treatment, within a year or two, we are seeing that the original symptoms of depression coming back. Mm. Hey, what's going on? We're giving you enough serotonin. Why on earth are you still depressed? We call it the pooping out. And that's when, oh, this medication is not working for you. Let's try something else. Mm. This whack-a-mole happens at that time. And we see the same thing with antipsychotics. In fact, with antipsychotics, we see syndromes like antipsychotics traditionally reduce dopamine levels and they seem to reduce agitation and hallucinations and delusions. But when you continue this antipsychotic, not only do we see sometimes a reemergence of the psychosis, but at other times we see syndromes like tardive dyskinesia, which is a very, very difficult side effect to cope with. It's these abnormal involuntary movements that can happen in the facial muscles, in your upper extremities, in your lower extremities. It is very stigmatizing for patients. It interferes with their quality of life, with their everyday functioning. And one of the leading hypotheses for tardive dyskinesia is actually dopamine imbalance that is created by the antipsychotics. So before the advent of these medications, we rarely saw these kinds of tardive phenomena. And it can happen even with antidepressants as well. So with all of this happening, and when you take a step back and say, hey, what's going on? This should not have happened. Why is this happening? And of course, wonderful physician researchers like Peter Gosha and Joanna Moncrief and her colleagues, her team, these two people and many others too, but these two come to my mind currently. They have not only documented their thoughts, they've actually done some credible research, which is mainly meta-analysis, looking at pulling together all the studies for a given question and looking at what is the evidence that can come out of this meta-analysis. And in doing these kinds of studies, what we are finding is that there is no chemical imbalance that stands out as a definitive theory. In fact, Joanna Moncrief, I think her study was published in July of 2022. I believe it was a New England Journal of Medicine. Don't quote me on that, but if you type in Joanna Moncrief and depression hypothesis, serotonin hypothesis, we'll be able to get that study. But basically, she did a huge meta-analysis looking at almost all the studies that exist that links the idea of serotonin as a cause for depression. And basically, they did not find anything. And so they have rightly questioned the whole chemical imbalance hypothesis. So,
interesting. So does that mean that no SSRIs or any of the other antidepressants out there will work?
That is my understanding, and that is also my observation with my patients. Like even today, the new patient that I saw, she's 21 years old, childhood onset of anxiety and OCD, has been on various medications, develops a lot of side effects with them, and none of them have helped her. And she's somebody that was born with acid reflux. Like right as a baby, she had severe acid reflux and projectile vomiting. So right there, we see the gut-brain connection. And she still continues to have acid reflux. She has a severe constipation. So these symptoms that are so glaring, they're not put together. And she looks very pale. I suspect that she has. I have a bunch of blood work recommended for her. I would suspect that she's nutritionally depleted, probably having iron deficiency, probably carnitine deficiency as well. And with the constipation, she's reabsorbing the toxins. And standard, young woman in today's world with makeup that she's using, she's getting a regular dose of toxins. So, and she works for her dad's construction company as she cleans up the condos that they own and not using cleaning agents. So there's, again, another load of toxins.
Right.
Yeah. So these are mold. Yes. Yeah. So I do have, I do testing to rule all of this out. I didn't think of mold when thank you for bringing that to my attention, but that is part of my standard protocol, is that I do mold testing for all my patients because it is so common. And then the toxins too, almost everybody comes back positive for glyphosate in their urine and aspergillus. This is the two things that I see without fail in the testing that I do. So then we address that, and we do see the recovery in symptoms.
Excellent. And so what's happening when somebody, people might be listening to this and saying, oh, but my Prozac is really helping me. Is that placebo, or is it, maybe there is some sort of, so what do you think's happening there?
According to Evan Hirsch, he's a therapist who's done a lot of work in this area of antidepressant and the placebo effect. So if you look at his studies, then you will think that this is nothing but the placebo effect. But again, so let's look at the concept of medicine. What is a medicine supposed to do? We become sick, we take a medicine, we get better, then we stop it. Does it happen with Prozac? Does it happen with any antidepressant? In fact, if they stop it without addressing their root causes, at the bare minimum, they'll have a relapse of their original illness, But most importantly, many of these patients actually go through pretty bad withdrawal. In fact, coming off of Prozac is when I've seen many patients develop tardive dyskinesia.
Oh.
Because all of these medications are messing up with our neuroarchitecture and our neurochemistry. So if you really apply the concept of medicine, that's how it should be. So even for patients that are coming into my practice, I'm not a magician. It's not like 100, I don't have 100% success rate. And I tell people it's not because of their fault. It's, I don't do Lyme disease testing. That's outside my wheelhouse. Maybe it has to do with Lyme disease. Now, that is one thing that I know I don't know. But what about the unknown unknowns that I have? So I always tell patients that if I'm not able to help you in 3 to 4 months' time, if you're not seeing benefits, then it's time for you to find somebody else. But we should try everything that I'm offering. Try it with good intention, diligence, and attention. And if it doesn't work, then you should explore other avenues, because I know this much, and this seems to help majority of patients that come into practice with me. But there are things that even I don't know. And for that, I do have a network of physicians that if I suspect Lyme, or if somebody's not responding to what I'm doing, then I do refer them out to other providers in the area. But I want to say that for 90 to 93% of patients that come in, when we address the diet, trauma, toxins, and that can take, like the toxicity, I do a very extensive mold, environmental toxin panel, the whole organic acid testing, all of that. So that gives me wonderful information about how to intervene, where to intervene. Plus, I do methylation gene analysis. So that also gives me a lot of information. And we focus. So it's rinse and repeat. We add the good diet, we detox, we provide the vitamins, and then people get better. Then they seem to have a little bit of a downslide. Again, rinse and repeat. We do this over and over again, along with people learning how to be kind to themselves and working on their self-worth. So this process keeps on happening over and over again until they cross on to the other side. So that's the hope for everyone.
Yeah, that's excellent. I love the fact that you know your wheelhouse, you know what you're good at, and sometimes that there are times where you can't help somebody. There's a cause out there. I mean, we're looking at 39 different causes, and there are times where we can't help somebody. There's something that we don't know, or like I tell people that we know about this much in a stadium of 100,000 people, right? Like we just don't know a lot when it comes to medicine. Even though we're practicing functional medicine, we're understanding a lot more than conventional medicine. So I appreciate the vulnerability. Thank you.
Yeah.
So let's talk a little bit about infections other than Lyme. What other infections do you see that are playing a role? You talked about stool, or you talked about some of the gut issues that people see. Do you see infections on stool testing? Are you working on any of those right now?
So I don't do infections with regard to I'm not doing stool testing. I do primarily the oat, which gives an idea about the fungal and the bacterial metabolites. So most of the times, again, when there is leaky gut and inflammation, I go with the hypothesis that there is bacterial and fungal dysbiosis. SIBO is happening. And then clinically, based on their breath, how their breath smells, we can differentiate whether it's more fungal or bacterial. I do use all my 5 senses in the room. So, sometimes I have actually reliably diagnosed people with fungal infections simply by the odor that they have, their body odor. And that has been proven positive with tests. So those bacterial dysbiosis, fungal dysbiosis, these are the things that I feel very comfortable treating. And I off late, I'm actually like, even with this young woman today, and with a young gentleman who's 26 years old, came in with the diagnosis of schizophrenia, and he's been sick for 6 years, 5 to 6 years, has been to all the major hospitals and residential programs in this country, spent thousands of dollars. And he was on a crazy regimen of medications, still very symptomatic. And I started working with him since August 4th. And with the approach that we have taken, he became symptom-free as of September 10th, except for anxiety, but no delusions, no hallucinations, none of those overtly psychotic symptoms. And all I'm doing right now is helping him come off of the crazy regimen that he was on. And of course, we found out that he's having NASH, non-alcoholic steatohepatitis, because of the metabolic syndrome caused by these medications. To give you an idea, he was on 85 milligrams of olanzapine, 1,500 of Depakote, 900 of lithium, plus 1,000 of metformin and 60 of propranolol. So, I mean, 85 of olanzapine is a criminal dose. There is no justification to put anybody on that kind of a dose. But looking at so I did send him out to somebody else because he is a very complex patient and he was getting better, but I wanted to cover all bases. And we did find that he's having elevated streptolysin titers, ASLO. So he did present with OCD earlier on in life, as a middle schooler and high schooler. So was it post-streptococcal infection? He also has antibodies to Epstein-Barr virus and mycoplasma antibodies. So now we got all of those tests back, and the question is, do we treat them with antibiotics? I am a little hesitant about that because his gut is doing really well. And I've sometimes high-dose probiotics and herbal antibiotics and herbal antifungals seem to do the trick. So that's my next level of recommendation for them would be to do a month or two of the herbal antibiotics and herbal antifungals while continuing to massage the immune system back to health. That's going to be the foundation of anybody's recovery process, is balancing our immune system. Everything in today's world is so inflammatory, and we really need to actively seek out anti-inflammatory ways or inputs to, like I said, massage our immune system into a state of balance. So that's the pathway that we'll be taking. So even with infections, and also with all these infections, there is always the component of the toxins, whether it is with the die-off release or even just active toxins that the bugs can make. So always having a binding agent or, glutathione or N-acetylcysteine, these also become part of the protocol at that point in time.
And I think one of the things that you're also referring to is the fact that people have multiple causes. It's never just one thing. Which I think is always important. As humans, we want to simplify things and we would love to have a unifying hypothesis and just have one diagnosis. But the reality is that there are lots of causes. And the sooner that people get their head around that and that all of them need to be addressed, the sooner that they buy in and the sooner they get better. Would you agree?
Yes.
Yeah, so totally agree. Yeah, so let's talk about COVID, long COVID. Spike protein illness. I know that you've delved into this and you've had success. So can you talk to us a little bit about what you're seeing in mental health with COVID and long COVID and what your approach is?
Sure. So COVID, it's not an enigma as people would have you believe. Again, so I mean, to be fair, I was very afraid of COVID in the beginning. Why? Because when we don't know what it is, we tend to be afraid. But as soon as some studies began to come out, I started to, look at some of the studies that influenced my thinking were coming from Singapore, South Korea, Japan, and even from China. But, let's exclude China. We don't trust everything that comes out of there. But even from all of these countries. And then here within the United States, Stanford actually did a seroprevalence study very early in March of 2020. And they found that there was a majority of COVID patients were actually asymptomatic. So that very dramatically brought the case fatality rate down to being comparable to that of the flu. And even though the authors of this study were trying to get attention and trying to kind of calm down the hysteria and all of that, it did not, people were not paying attention. Then some of the things that were coming out, like, there is no treatment for this. I never bought into that because as a holistic physician, as a functional medicine physician, we care more about the balance within us. COVID can come, its grandfather may come, but it doesn't matter about the other person or the other agent. What matters is how we are, how balanced we are. And in our population, we know that majority of us are chronically inflamed. So any virus is going to destabilize us. Any bacterial infection is going to destabilize us. Anybody with chronic inflammation. So thinking along these lines, I began to realize that no, it's not as crazy as that. It's not as bad as that. We need to tell people how they can improve their immune system balance. So it's not about energizing your immune system in this situation because everybody's already on fire. We actually want to bring that fire down. And I realized that, again, it goes back to the anti-inflammatory diet, goes back to eliminating toxins and taking vitamins such as vitamin D. Very, very important vitamin and prohormone, very important for regulating the immune system. And the other thing that is also just as important is fish oil. Fish oil is not only for the gut, for the brain, but it actually has a calming effect on our immune system. So it regulates many different aspects of the anti-inflammatory cascade. And it is, on the one hand, we have the arachidonic acid, and then we have the omega-3 pathways. So it really enhances the anti-inflammatory pathways. That's what we want. We want the pro-inflammatory to come down and the anti-inflammatory to go up. So we have very easy, cost-effective. I mean, vitamin D is less than $1 per day to get 5,000 IUs of D3. So these were the things that I started to look at. And I did come up with a protocol for acute COVID infections, which we have used successfully in my practice. Then came long haul COVID, which again, anybody that has been practicing medicine, we know that we see these kinds of post-viral syndromes with any virus. I've treated post-flu anosmia before. I've treated post-flu chronic fatigue syndrome before. So none of these things are new to the virus. So all of what was coming from the mainstream did not make sense to me at all. So, I mean, not even going into any of the conspiracy theories, what I began to see is that, hey, what they're saying does not match up to my lived experience. That is what I was seeing. So then, but what is my lived experience? I know how to treat post-viral anosmia. I know how to treat post-viral chronic fatigue syndrome. Why not do the same thing? Because ultimately our immune system is the same. It doesn't matter what virus it is. So we started implementing the same thing. Again, the principles are very much the same thing. Anti-inflammatory, bringing the immune system into balance, detoxification, nutritional supplementation, mitochondrial rejuvenation when chronic fatigue is happening. And for detoxification, Ayurveda has a wonderful treatment protocol called Panchakarma. It's a 7 to 10 day detox protocol, which we do in-house here. And I'm in the process of actually trying to see how we can make that possible, even for a virtual audience as well. That's the project for the next 3 months. But once the Panchakarma is absolutely wonderful to balance many different organ systems in our body, mainly the immune system. And to draw parallels to modern medicine, and again, no studies have shown this, but the way I understand it is that it reliably removes not only environmental toxins, but also the toxic chemicals that our body makes, which could be an abundance of inflammation molecules, immunoglobulins. So in that lens, you can almost say that it acts like plasmapheresis or like dialysis. It removes all these impurities from our system and eliminates them, allowing for our system to thrive in its natural state. So Panchakarma is absolutely something that we recommend for anyone experiencing long-haul COVID. And finally, hyperbaric oxygen therapy, which is wonderful for mitochondrial rejuvenation. And it is also antibacterial, antifungal. It releases stem cells. So this is kind of the broad protocol that we have for long-haul COVID. Or for many of these chronic syndromes, like for even multiple sclerosis, this would be the same protocol. The individual herbs that we use will differ from person to person, but the overarching theme of what we are doing is the same.
Excellent. So Aruna, thank you so much for joining me here today. Where can people go and learn more about the work you're doing?
So my website, trinergyhealth.com. That's TRINERGY health.com. My office number is 262-955-6600. And Erica is my wonderful receptionist. She's really good and she can help people with what they need. And people can also follow me on Facebook. It's facebook.com/Trinergy Health. On Instagram also, it's Trinergy Health. Twitter, it's Trinergy, I forget, but it's, my photo is there, so people can, recognize me. But Instagram, it's Trinergy Health. And I'm more active on Instagram. I do a lot more videos and share my thoughts about different things on Instagram at this time.
Wonderful. Well, I so appreciate the work you're doing and the awareness that you're bringing to these mental health issues. Thank you so much for joining me today.
Thank you, Evan. Thank you so much for having me.
I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening and have an amazing day.